Hello and welcome back. I'm having a really good voice day today. And when I say really good, I mean like maybe the best day I've had in about a month. My voice feels kind of silky and smooth and just kind of the way it used to feel, mostly. And I'll tell you why in another video, but I thought this video I would take the time to go over some of the symptoms I've had with muscle tension dysphonia over these past 18 months. Because I think a lot of times when you read about muscle tension dysphonia on the internet, they just kind of say, well, it's difficulty talking, tense muscles, stuff like that. There have been so many other symptoms that I've had that don't exactly fit in with that, and so I thought it might be helpful if I kind of just describe some of those to you. So I'll try and make this short, but there's a lot of symptoms here. So yes, symptom number one is just fatigue when using your voice, and I think that comes in a few different flavors. One flavor for me is that on some days it's hard for me to push the pitch of my voice down to the level where it usually sits. Like, this is my usual talking pitch. It would be easier on those days for me to talk up here, but that's kind of an odd thing to do. But when I try to actually kind of put that edge on it and get down to my normal speaking range, it starts to feel hoarse. It starts to feel like my voice is going to give out or something like that. Another symptom is complete lack of power and volume behind the voice. Like this would be about as loud as I could speak on a really bad day. Whereas on a good day, like today, I can actually raise my voice and project a little bit. Not that I want to overdo that, but it's nice to be able to do that. Another symptom is, I had this whole other constellation of symptoms having to do with inside my mouth and my soft palate. Now, if you remember, if you studied singing at all, your soft palate is the back part of the roof of your mouth. So kind of back there. Your hard palate's in the front, soft palate's in the back. And I notice that sometimes when I do a lot of talking, my soft palate gets really sore, really achy, really tender, really dry. And sometimes yawning helps that. Sometimes like swallowing or eating a meal can help with that. But I realized just a couple weeks ago that I was kind of feeling around in the inside of my mouth, and there was one spot in particular on both sides, but on this side worse, where it was really sore and tender, and there was kind of a bony prominence there. And so I was looking online. It's just right behind the top teeth in the back, on the roof of your mouth. There's this prominence called the pterygoid hamulus, and it's a little bony protuberance that comes out of your skull bone, and it attaches to some tendons that go down this way, but around it, so around the pterygoid hamulus wraps this muscle and kind of glides this muscle called the tensor veli palatini. And what the tensor veli palatini does is it assists in raising your soft palate. So if you yawn, or if you sing, if you're singing a very tall vowel and you're you're making that cavernous kind of vowel in the back of your mouth, that's the tensor veli palatini that's doing that work. And mine sometimes feels totally overworked. And that's not something that you usually talk about with muscle tension dysphonia. I found a woman on the internet who said she's had the same exact problem, and her speech language pathologist told her she's opening her mouth too wide when she speaks, and it's just kind of a habit. And so maybe I'm doing that too. I asked my speech pathologist about it today, actually, and she wasn't sure, had never heard of that, but it's something to maybe just for me to keep my eye on and just kind of be aware of. I put some benzocaine anesthetic on those spots today, and it actually did feel better. So yeah, there's something going on there. Oh, and another thing I've noticed with that pterygoid hamulus is sometimes if my voice is really tired and then I eat something acidy like lemonade or pickle or tomato sauce, I can actually feel it burning my throat. And I always thought that's a very strange thing to happen because, it just doesn't go along with what you usually hear about how the voice works. But, if the muscle is wrapped around that bony prominence and then it's pulling and tugging, and maybe it's like making the overlying tissue a little sore. And that may even have been, I mentioned in my first video that I had a little bloody taste in my mouth. That may have even been what that was, just that the skin over that getting raw. Another symptom I sometimes get with this is headache. If I'm using my voice and my voice just does not want to be used, it'll start giving me a tension headache coming up from the back of my neck. That's one thing I've had. Also, with a lot of vocal use, sometimes my throat starts feeling hot, just like the muscles are burning, like actually generating heat. You might try this. I don't know if this is everyone, but sometimes I notice that I get throat discomfort even if I'm not using my vocal cords. And what I mean by that is, sometimes I do a lot of praying, and sometimes I pray silently to myself, and so if I'm just going for a long time, I start to notice that the muscles and things are starting to hurt, especially those spots on the pterygoid hamulus I was talking about. So yeah, even just using my speech apparatus without phonating can sometimes generate symptoms. Sometimes I feel like it takes more breath pressure to just even produce a sound. And sometimes I feel like there's almost a blockage here, like kind of going into my sinuses. Like it's almost like it would be easier for me to talk like I have a cold, like pushing the air through my nasal passage is an effort. And that could be related to soft palate dysfunction with all those muscles I was talking about earlier. I mentioned this in the last video. Sometimes, and this is more if my voice has already been overused and I'm still trying to sing or talk or something like that, I will feel like, and it's hard to describe, feel like something is buzzing or scratching or vibrating where it shouldn't. I used the example last time of the personal handheld fan. It's almost more like a Dremel. I don't know if you've ever seen like a Dremel. I've got one in the drawer here somewhere. I don't know. Anyway, a Dremel's like a little power tool with like a sandy disc on it that spins, and if you like put it against your finger, it would cut you. It's almost like the vibration that's happening in my vocal cords is touching something that it shouldn't, and it kind of tickles and it kind of hurts and it kind of scratches, and a lot of times it just totally makes my voice fail. If I'm like singing a note like, oh, it'll just go, oh. Almost like just hitting a motor and it stops for a second. At the beginning, when things were really bad, when I first was having this problem, I was actually even having symptoms in my ears, like this rustling, crunching sound, mostly in this ear. And what I think that is that, again, I'm talking a lot about the tensor veli palatini in this video, but I think there's a lot of things going wrong with mine. So that muscle also controls the opening of your eustachian tube, and so maybe if there's a spasm in that muscle, it's pulling on your ear, the tubes in your ears, and kind of making things crack and crunch and rustle. And so I was doing some massage like this to try to get that out. I don't know if it really helped, but I haven't had that symptom in a while. One of the most irritating parts of this is I just can't laugh the way I usually laugh. I can't just burst out in laughter. And I also, it's hard, today I'm doing pretty well, but a lot of the time it's hard for me to do my normal vocal mannerisms, like, oh yeah, those kind of things. I'm talking to my friends and then I interject a little bit of laughter into my voice, or I go up, I go down, and so when I'm having a bad day, it feels like this is just all I can do, just staying in this little range right here. There's no volume change, there's no expressivity, and if I laugh, it's kind of either just silent through the nose, or it's something like that. When in reality, what I'd like to do is just actually laugh, Impossible on a bad day. Sometimes you feel pain and fatigue with yawning and swallowing. Now sometimes yawning and swallowing help, but other times it's almost like you're stretching a muscle that's already been stretched too much. I mentioned in my first video that a lot of times it feels like there's a lump or something pushing my voice box over to one side and maybe like setting it a little bit off of balance, off askew or something like that. Certain phonemes can be hard to say. I know for me, Now I know I have the problem of kind of maybe talking a little bit too far back in my mouth, and I'm not sure yet how I'm going to address that. Forward resonance is supposedly very important with this, but certain words seem to cause a lot more tension for me to say. Words with the E vowel, like east, yeast. Also, the dark L. Now, English has two L sounds. It's the light L at the front of the mouth, the le, and the dark L at the back of the mouth, like old. Old is a really painful and difficult word to say if I'm having a bad muscle tension dysphonia day. So that's kind of a rundown of a lot of the uncommon symptoms I've experienced with muscle tension dysphonia. Are you having any of these symptoms? Let me know in the comments. I'm always interested to hear what other people have experienced with this. Have a good night.